we are going to start the infections in immunodeficiency. In the immunodeficiency state, the patient or human being are so much or a high risk and are prone to all the infection. It is bacterial, fungal or the viral. So first we have to start from the pathogens. When the patient, in which condition patient have a more prone, having a more risk for the bacterial infections? Yeah, obviously when the B cell, in the decrease in the level of the B cell, there will be high risk of bacterial infection. Most commonly, which bacteria? It will be encapsulated bacteria. And what are encapsulated bacteria? The bacteria that are surrounded by polysaccharide capsule. That bacteria is called encapsulated bacteria. This capsule acts as a protective layer, making them more resistant to the host immune system, specifically phagocytosis, engulfment by immune cells like macrophages. And this capsule is sometimes act as a virulence factor, meaning it increases the bacteria to ability to cause disease. And the B cell is a more dominant thing that fight against the bacterial infection. So they are one mnemonic pre-shine by skies. Biggies, Pseudomonas aeruginosa, Streptococcus, pneumoniae, Haemophilus, influenza type B, Neisseria meningitis, Escherichia coli, Salmonella, Klebsiella, and group T, Streptococcus. And if there is a decrease in granulocytes, so which bacteria are going to cause more infection? There are some bacteria produce no serious granules. It is a mnemonic. So for S, we are having Staphylococcus, Burkholderia, Capsaicin, Pseudomonas aeruginosa, Nocardia, Serratia. These are bacteria that are going to produce or cause infection when there is a decrease in granulocyte in human beings. And due to complement system, we also have an encapsulated species with the early complement deficiencies. If you know in complement, there are two types, early complement and late complement. If there is deficiency for early complement, then there will be encapsulated species infections in that human being. If there is a late complement deficiency, then most commonly there will be Neisseria recurrent infection. If we talk about the viruses, there will be, in the viruses, there should be decrease in T cells because you know the CD8 positive cytotoxic cells are going to act against or fight against the viruses. So if there will be decrease in T cells, so there will be recurrent infection by cytomegalovirus, Epstein-Barr virus, GCGI virus, varicella zoster virus, chronic infection with the respiratory and GI viruses. B cell having no as much effect on the virus is recurrent infection, but some of viruses also cause infection in the absence of B cells, that are enteroviral encephalitis, polyviral in the patient having decreasing B cells. The live vaccines are contraindicated. And for the fungi and the parasites, both the T cells and B cell matters, so mainly the decrease in T cell effect or cause the recurrent infection of fungi and the parasites. The Candida local is a PCP. The PCP stands for the Pneumocystis pneumonia, is a lung infection. Pneumocytosis pneumonia, and is caused by the fungus Mnemonics jirovecii. So there one is Cryptococcus. They mostly happen due to decreasing T cells. Secondly, if there is a decrease in the B cells, then the high risk of recurrent infection of the GI giardiasis due to decrease in IgA, because IgA is going to produce for B cells. And also granulocytes, if they decrease the granulocyte, they can be systemic candidiasis infection, Aspergillus and Moco. If we make a summary of all the things, you just have to remember one thing. If there is a decrease in the B cell, then there is a more chance of bacterial recurrent infection. If they are decreasing T cells, then there is a highest chance for recurrent infections or infection by the viruses. So they already mentioned the B cell deficiency tend to produce recurrent bacterial infection, and where T cell deficiency produce more fungal and viral infections. That is a summary of the table.